When you have a victim who is a bigger body mass and they're hit with gunfire, that's one thing. Of course, it depends on where they're hit. But when you have a child and it's a smaller body mass, can you talk about the scope of devastation when it's a child?
I mean, I think, so the psychological aspect, I think I mentioned a little bit earlier, how, managing one child is difficult. Managing a multitude of children at the same time takes an enormous amount of resources. But I think, if you're talking specifics about like ballistics and the injury, am I getting your question? Like you're talking about what the bullet does to the specific body part?
Not necessarily, just that, you have a smaller body mass and a bullet.
Yeah.
And on the smaller body mass, that the potential for the devastation is
Yeah, so children, when they're injured, have a unique ability to sort of maintain their circulation in their life, sort of like their blood pressure and their heart rate and stuff, keep themselves alive until they don't. So adults are a little bit more telling. Children are seemingly, they sort of are kind of plugging along and then all of a sudden they're not. And we'll talk a little bit about the minutes and seconds and sometimes matter. But in these circumstances, I mean, one bullet wound to a chest in a child, if it's in a place where there's big blood vessels and things that could end your life quickly, there's not as much room for error. And so you have to evaluate them quickly and manage them efficiently and fix basically the holes that are made from the bullets. But as far as I don't know if I'm answering your question correctly, but the stakes are a bit higher. I think would be the answer, the short answer.